My name is Mario. Welcome to my channel. I've been a clinical research associate for 12 years approximately, and I've been in clinical research for 15 years. So, one of the most commonly asked questions that I get is, Hi, I'm a clinical research coordinator. How do I transition to be a clinical research associate? How do I go from being a CRC to a CRA? So that's the focus of this video. So hopefully I'll be able to give some insight into how to make that transition process. And I'll start off by talking about how I made the transition process. I transitioned in 2008. It's currently 2020, so obviously times have changed. So some of the things that I did in 2008 may have been different from what you'd be going about and doing in 2020. So let's start off with how I made the transition. So I was a coordinator for 2 years at the Dana-Farber, and then a lead coordinator for a year at Stanford. I worked in pediatric oncology with children's oncology group studies primarily. So once I was at Stanford, I sort of knew that I wanted to go on into a pharma company and into industry. I wasn't certain about what roles, so I applied to CRA positions, and it got frustrating. I must have been applying for months and months and months on end, and there was just no traction. I talked a little bit to the CRAs for suggestions, and the CRAs that came to my site basically said just keep applying. So I did, and I applied on what used to be the big job sites at the time, Monster and Career Builder, and the closest I came to getting anything off of those was a company that I believe was based out of Carlsbad, California. Their CEO visited Stanford, and in the process of visiting, we had an informal interview. The informal interview went well. He said, "Oh, I'll take it back to the team. There's a pretty good chance we're going to make you an offer." And honestly, that was the last I heard from him. So that didn't materialize. So I got frustrated in the process, and you likely will have to do a lot of applying. So one day I decided, well, I've looked on all the job-oriented sites, and nothing has really come off of them. Why don't I look on Craigslist? Now, Craigslist is not the first place that people think to look for jobs on. That said, I actually found a job posting for a clinical research associate for a company based in Burlingame, California. That said, we're a startup, we're looking for a clinical research associate. If you're interested, let us know and apply on this website. So I applied there, and that is the first CRA position I had. One of the cool things about being at a startup was that it was only 20-ish people. So I had a role that was a hybrid between what an in-house CRA would do and what a field monitor would do. On top of that, if I was interested in different areas, I could just walk to the person who worked in that area and see what they did. For example, the office of the person who was director of regulatory affairs was pretty close to me, so often I would learn about how submissions were made to the FDA. Quality assurance was also available to me, so I could walk over to the director of quality assurance and say, hey, what are you working on? Similarly with manufacturing. So that gave me a good understanding of all the different areas that go into the clinical trial process, and really gave me a sense of what I may or may not be interested in pursuing longer term. So I was at that startup for 2 years. Unfortunately, they had a failed phase 2 trial in humans. Eventually, that company disbanded. Their animal health division was acquired by Bayer, but I was basically laid off and looking for work. Once I had the 2 years of CRA experience, my subsequent job search was significantly easier from there, and I ended up at a larger CRO. So that's a bit about how I made the transition. Like I said, this was 2008, and I ended up at a startup. Now, startups are a great place to look because often startups are not as desirable for people with a ton of experience, and probably not the first place people are looking. So often you'll have pretty decent luck, hopefully, with startups willing to take on and do some of the training. And really, at a startup, it's whatever the need be. I helped QA, I helped regulatory affairs. Whatever is the pressing need, you're going to be working in there. There's no real job division uh, per se. If you need to be packing boxes to rush something, you'll be packing boxes to rush and ship something. So that is the startup environment, and I do encourage it. The thing that didn't occur for me, but there is also the potential of going to a startup, is equity offering. You get equity if the company does well. You may have a windfall from that. For example, if you join Moderna as a startup, even though there's still no approved COVID-19 vaccine at the time of this video, Moderna's stock has skyrocketed. Um, so if you happen to join them in their startup phase, you'd probably be doing reasonably well now. So the more common way, rather than joining a startup, is to do what's called a bridge program, a CRC to CRA bridge program. Most of the major CROs will have some form of a bridge program. So basically, what they're looking for is people with a lot of coordinator experience, and they focus on teaching them to be a CRA. I applied to some of these bridge programs. I didn't have much luck. They have seemed to have grown, and they're much more common now. So if I were doing the search in 2020, that is where I'd start. The job website that I would make sure that I was a part of would be LinkedIn. A lot of jobs do tend to be posted on LinkedIn nowadays. You can also look on Indeed as well. And you should have some traction, and just know that it's going to take a lot of applications and a lot of persistence. So if you really are interested in becoming a CRA, just keep at it, and you will eventually get your chance. So I think that's how I can best describe how to go about this. So talk to your CRAs. Your CRAs will often know if their CRO is hiring. They'll often know if that their CRO has a bridge program that's about to start, or they'll have that sort of insight for you. So you'll have that portion covered by talking to your CRA when they're at your site. And then definitely look online at places like LinkedIn and Indeed. Um, and hopefully you'll get some traction there. And oftentimes you can just connect. If you can find me on LinkedIn, for example, and feel free to connect to me. There are a lot of recruiters within my network. Granted, a lot of recruiters tend to focus more on people with experience, but you might get lucky. The only other thing that I really have to say on this topic is just make sure you understand what you're in for. I say this having helped a few CRCs transition to being CRAs, and usually within a year, I am told, man, there's a lot of travel. Yes, that's what you signed up for. There is a lot of travel. So if you think travel is going to burn you out, this isn't the field for you. I started off in my first 2 years as a nationwide CRA. So I was based out of San Francisco, and I often got sent to Kentucky or Nashville, Tennessee, or just really anywhere. So between the time difference and the amount of travel time, etc., it was pretty exhausting. The good news is that you get more experience, and really today more CROs have gone toward a regionalized model, so you're more likely to travel within a certain region. I, at one point, working for the startup, did 5 site initiation visits across the country in a week. By the middle of the week, I didn't know what state I was on, what time zone I was in. It was nuts. I started in Rhode Island, and I did visits, I think, in Norfolk, Virginia, in Salt Lake City, Utah, in Lenexa, Kansas, among other places. So doing 5 site initiation visits back to back in a week and across the country is pretty tiring. Then that said, once you, it's not just do the site initiation visit. Once you get back to the office, you need to write all your reports. So there is some of that if you do go to a startup. So just be aware. And if you go to a large CRO, there will be travel. It's inevitable. There are other roles within CROs that you can transition to that don't require as much travel. There's the clinical trial associate or CTA position. Usually those are based in an office somewhere. There's an in-house CRA as well. So you may want to gravitate more toward those positions if travel is not something you're up for. All right, I think that's everything I have. Thank you for watching.